everyone, my name is Gary. For those of you who don't know me, I'm a respiratory therapist, a respiratory care practitioner, and I have Deja here with me. She's a physical therapist.
Yeah, so I'm Deja. I am a pediatric physical therapist. I've been practicing for a little over a month now, and I live in North Carolina.
Awesome. I'm in Southern California, so I've never unfortunately really been to the east side besides just stopping off in New York at JFK. You recently just got your license. Are you currently practicing? And if so, are you practicing at a hospital? Are you doing more like home health stuff or outpatient, inpatient? What do you do?
So I've been practicing for a little over a month, and I work in home health, or it's considered early intervention because it's pediatrics. So I work with children 0 to 3 months who typically have developmental delays, whether that's due to being born premature or because they have some kind of established diagnosis, like maybe cerebral palsy or Down syndrome or something like that. But that's kind of my niche and my patient population.
That's so niche. That's so unique. And so how did you get into that? And did you come across anyone else on social media who does this? Because it's so specific. What drew you to that?
So I came into PT school knowing that I had a big passion for peds. In undergrad, I actually volunteered at a muscular dystrophy camp for a week. And I knew I had an interest in peds before that, but after being at that camp and just being with those kids and just learning so much and just getting to help them throughout their daily lives and their daily routines, I knew that I wanted to work in peds. So in going into PT school, I know I had that interest, so I made sure to take a peds elective. I ended up getting a peds rotation, so I spent 3 months in acute care peds in the hospital, where I saw babies as young as 3 months up to teenagers that were 18. It was a very wide range. I would see babies with developmental delay, but I'd also see 16-year-olds who had spinal fusions. So it was a lot. It was a lot of variety. But during that clinical rotation, I realized how much I loved working with the babies, especially the babies in the cardiac ICU and the PICU and step down. That was my jam. So I knew that I'd want to work with the younger kids. And then I spent a day in the NICU, and I thought that was interesting too. So after that clinical, and it was my last clinical, I was like, okay, peds all the way. And I love the babies. So I initially thought that I would just, go into the hospital, kind of be a general peds practitioner. And then maybe down the line, get into the NICU, because it's really hard to get into the NICU as a new grad. And most of the PTs that are there, even nurses, anyone that's in the NICU, they get there and they stay there. So it's not a lot of turnover. So I was like, okay, I'll get a hospital job, just start there, get my foot in the door. But it was hard. A lot of places don't hire new grads for peds because it is more specialized, and they just, they don't want everybody just working with the babies. So I applied to a few hospital positions, but it was before I was licensed. So while I was still waiting to take my exam, so didn't really hear anything back from those. I figured because I wasn't licensed yet. And then once I took my test, I applied for a home health position that was in early intervention. And I had heard about that a little bit in the hospital because it's typically those kids that were in the hospital, once they get discharged, they have early intervention services to keep up with their milestones and make sure that they're still on track. So that's what I do. I see a lot of the kids that were born in the hospital system that I did my clinicals in are now in this early intervention program, and it's run by the government. So a lot of job stability, and I really like the flexibility of it because I get to kind of build my own schedule. And if I don't want to see kids on a certain day, I don't have to. But yeah, so that's a little bit about that. I saw a few people online that did early intervention, but not really. I didn't really find people that did it until after I had already accepted my position and wanted to, learn more information about it.
That is so cool that you get to see them after they go home, because I feel when, most of us who work in a hospital, you just don't really hear from them, and you don't really know what happened to them after or get to see that progression. So that's really cool that you get to experience that in a different setting, with them at home, and see that progression and be a part of that progression. They're getting better and because of you, so that's It's honestly really cool.
Yeah, when I was in the hospital, one thing that was hard for me was getting so attached to these kids, and then I left or they went home, and I mean, sometimes they follow up, but most of the time they don't. So I always wondered, like, I wonder how they're doing. Like, I hope they're doing well. Like, I hope they're getting better. So this gives me that like continuum of care that I like really enjoy. So
And so like because they are at home and they're better, they're good enough to be
mhm.
at home. Are you doing less like therapies that you would be doing than in the hospital, or are you doing the same thing, just like continuing? Um,
Yeah, so it's a little of both. It depends on the kid. Most of the kids I've seen so far, they haven't like they've been weaned off of any equipment that they were on. So like some kids come home with lines and leads and like G tubes and stuff like that. But the kids I'm seeing now, like they're either about to get their G tube taken out or like they're not on oxygen anymore. So they're doing a lot better medically. So in the hospital, a lot of it was like positioning, some gross motor milestones like teaching how to roll and like sit up, but like now that they're home, it's a lot more of those milestones. Like a lot of it, there's a lot of overlap. It's mostly like sitting, crawling, rolling. Because the kids are so young, we're not really working on walking yet, but those are the main things, like sitting, crawling, rolling. Those are
rolling,
the key things. Yeah.
they're
And
so
like just
funny.
tummy time is a big one too, and like holding their head up and just teaching the parents how to do those things when we're not there.
Yeah, that's so cute. That's so cool. Do you
I
think you'll
know.
like go back to like peds NICU hospital, like once you have a little more experience, or do you think you would, if you couldn't get a peds or position, would you go to adults for like a year and like try and get that more experience and hopefully go into peds, or would you stay with what you're doing now? Like, are you happy with it? And you could see this as like a longer term position.
Yeah, I'm really happy with this. I did not expect to love it as much as I do, but I really do like it. It has a way higher earning potential than working in the hospital does.
So yeah.
And I just love the flexibility. Down the line, I could see myself returning to the hospital. If I did, it would probably be NICU. Like I wouldn't want to just see that like not that I don't like older kids, but I just love the nicheness of the babies and stuff. So if I did return to the hospital, it would be NICU. I probably wouldn't go back to adults just because I love peds so much, and having experience in adults doesn't really translate to peds, like even if it was in the hospital. And because I already have that little bit of hospital experience with peds, I feel like that would be enough to get my foot in the door now that I've been working in peds outside of school.
I feel like that's like anyone's like dream, is to like, like you didn't really get what you wanted, but then you stumbled across something that like you just happened to fall in love with and
I
enjoy. And
know.
it's like, you get to make your own schedule, and like the pay as well, and it's government funded, so you're guaranteed that
Hmm.
stability. And like that's just really awesome that you like, I actually have chills, like like just because I know that feeling of like just coming across something and you're like, wow, like who would have ever thought that I would have this or do this or become this, so that's like really really cool. um
Yeah, it was very surprising. Like I'm kind of waiting for the other shoe to drop. Like, is this real? Like, do I really enjoy this that much?
they're gonna be like, wait, you said 1 month of experience? Like, no. This is your 1 month, right, of experience with
Yes,
them.
this is my 1 month. Yeah. Mhm.
They're gonna be like,
They
you're
took
a
a chance
new
on me. They were like, "You're a new grad. We don't typically hire new grads, but like you have a good resume and you seem like you would do well in the position." So I'm so grateful that they gave me a chance.
That's good. That's good. That was like one of my first positions too. Like they were worried about hiring as a new grad, but they took a chance. And like, that's all it kind of takes, is just somebody to like see a spark in you, or to see your passion,
Hmm.
or see that you are like caring, intellectual, whatever that may be. So that's awesome. So like how long was the schooling process, and why did you choose physical therapy? Like, did you have to get physical therapy? Did you have a family member, or did you just like, what made you choose?
Yeah. So in high school, I knew that I wanted to work in healthcare of some sort. I went through like pharmacy, maybe becoming a doctor, all the things. And in one of my elective courses, we had to shadow a healthcare professional for just 10 hours. And my mom, she actually worked at a physical therapy office. So I was like, oh, this is easy. Like, I'll just ask her if
Yeah.
I can get hours at her job. So, like, didn't really think I would really like it, and then did those hours and I was just like, whoa, this is so cool. I really liked how the therapist connected with their patients and just how much time you got to spend with them. So that like drew me initially. And then I did more research and I was like, okay, this is what I think I want to pursue. So I went into college like knowing that I wanted to go to PT school. So like knowing all the prereqs I had to take, just being kind of on that tunnel vision to get there. And then I ended up taking a year off after to apply to school. So then I started school in 2018. Most PT programs are 3 years. So my program was 3 years. The first 2 are typically didactic, and then the third is all clinical. And that's how my program was. We had 3 long-term clinicals each 3 months, all throughout third year.
That's kind of cool that it's all in 1 year, your clinical. So you're not like mixing your classes with clinic, because that's how my program was. Well, we mixed it, and it was just like, it was so hard sometimes because you're going to clinic, but then like you have an exam the next day. It was like, it was a lot.
Yeah, we had short clinicals like during our first and second year, but it was like we would have a whole week to go to the clinic and we'd go as a group. So there'd be like 4 of us with a clinical instructor for like a week. So that was nice to like get some interspersed like during our didactic year.
Yeah.
But it was never like you go to clinic but you have class tomorrow. It was like this blocked off time that you're in the clinic with your small group.
See, that's really cool. Yeah, ours was like class 3 days and then clinic 2 days, and it
Oh
was,
gosh,
it was a lot.
that's a lot to balance because like you get
Yeah.
home from clinic and you're drained, like your
Yeah.
brain, you don't want to do anything.
No, but then you got the exam the next morning, so yeah, it was hard.
Like, what? That's a lot.
But I actually did an interview with Veronica, who's also a DBT, and it's
Love
really,
her.
she is great. I just met her at the
I
Face
know.
Party, the holiday party. Oh my god.
Yes.
I was like, ah.
Yeah, I want to meet her. So I just want to like give her a big hug. She's like one of the sweetest people ever.
She really is so genuinely sweet. But yeah, but we were like just discussing just how like similar like respiratory and physical therapy are. Like we both have like a workload of, like multiple patients that we're seeing throughout the day and doing, therapies to help with respiratory or, physical therapy. And yeah, it's crazy. I didn't realize like how similar they are and how like we can do a lot of the same things like home health or work at the hospital. I mean, except you're a doctor, I'm not a doctor.
I mean, nah, just like
yeah, doctor over here.
I have doctor loans, so I don't know if it's working.
I don't have those.
Yeah, you don't want them.
But something else that we have in common is you have a blog, and I was going through your blog, and you have such good information on there. Like it is so detailed, and like the pictures of your notes, like I'm gonna take notes to make my blog better, like off of yours. Like, but yeah, so what's your blog and where can people find it, and what types of information do you have there? Because I'm obsessed with it and I just scrolled like briefly and I'm not even into
thank you. Oh so it's the same as my Instagram name. It's just thecurlyclinician.com. So I share a lot of pre-PT advice. That's like the bulk of my content because I created my blog during that year off because I knew I wanted to help other students. Like I didn't have much help getting into school and I didn't know anyone that went through the process before me. So that was one of the reasons why I like got on Instagram, created a blog. So I'm like, well, if I'm struggling, then other students are probably struggling too. So that was like the chunk of my content. And then I got into PT school and I'm like, well, I can still like share my experience throughout school and help students in school. So then I created posts like about my like studying and just being in school. And then now that I'm graduated, I'm hoping to do like more like clinical stuff and like how being a new grad is. Just it's been very overwhelming and I just haven't had time, but that's like the bulk of it. And then throughout the years, I've tried to branch out a little bit and show just more of my everyday life and like lifestyle, like mental health, stuff like that. So I have a few posts on that too, but in the new year, I hope to continue branching out and sharing my life outside of physical therapy because we are more than our jobs.
That is exact same. Like I couldn't find anybody. Like there was maybe 2 respiratory therapists on YouTube and it wasn't like enough content, it was better than nothing, but And so I made my Instagram and I would just start posting, and because I was like, I need help. I'm sure there's other people who need help. And now like here we are with both of our Instagrams and our blogs. Any advice that you have for any peds aspiring PTs or just PTs in general, or what?
Okay, so we'll start with peds and then I'll do PT. So peds, I would say in PT school, let your professors know that you have that interest. Try to get a clinical. I know that can be hard. If you can't get a clinical, I'd say make sure you take as many like elective courses you can, and even like shadowing in peds outside of school will show that you have an interest in the setting and will look good on the resume when you apply if you don't get a clinical. Typical PT school, I guess applying to PT school, I would say try to find other people who are going through it too. That I wish I had that during my application cycle because I felt so lonely, and I did a lot of the comparison game to like people on forums and stuff like that. So just try to find other students that are applying that you can talk to, find people on Instagram that inspire you, that you can follow, that can keep your motivation up. In PT school, I'd say remember that grades aren't everything, because you can get the best grades in the world, but if you don't know how to talk to people and if you don't have those clinical skills, you're not going to be a good PT. So I'd say focus on your people skills and your clinical skills, especially with practicals, over trying to get 100 on the exam, because your patients aren't going to care that you got 100 on the exam. They're going to care that you can talk to them and have empathy and relate to them and treat them like a human.
That's literally like all what it's about. There would be, you know, people who are getting A's, but they don't know how to like walk into a room, and you have to
Exactly.
like know how to talk to someone and introduce yourself, and you have to like be like they're the patient, you know, so like you have to be like the provider, and you have to tell them what to do, how to do it, and why they're doing it, and be able to explain it and introduce yourself. And that's like so important, is just having people skills really at the end of the day.
Confidence too. Yeah.
Yeah, as long as, even if you're not sure, but as long as you act like you know what you're talking about.
Yeah. Regardless, you're going to know more than your patient because you are the practitioner, you're the clinician, you went to school for it. So
exactly.
Exude confidence. And if you don't know something, it's okay to be like, I don't know, but I'm going to look that up and get back to you.
Exactly. Yeah. There's so many times where I'm like, you know, that's a really good question. Let me check your chart really quick. You know, like you don't have to lie and make something up, and then you also don't have to like stumble and fumble. Like it's okay to say you don't know. And especially as a student, I would tell people like with your preceptor, you know, like it's okay to say you don't know or you're not sure, or even in an interview, you know, like, oh, that's a really good question, I haven't thought of that, or I would love to get back to you on that. Like, you know, it's okay to say you don't know.
Yeah. It's impossible to know everything.
It's impossible. Everyone needs like a little reminder, because sometimes we don't come across certain diseases or procedures or therapies. You know, we haven't done them like all the time, or haven't done them in a while. So. Well, oh my gosh, Deja, thank you so much for doing this with me. Thank you for sharing your experience and your blog. Oh my gosh. I need to get some pointers off of that and go through that a little
got you.
Thank you so much for taking the time out of your day to do this interview. I hope that this helps other aspiring physical therapists or peds physical therapists or physical therapy students. And I hope they learn something, because I definitely learned something, and I appreciate you doing this with me.
Yeah, of course. It was a pleasure. It was nice to just sit down and chat and even hear about like your experience as a respiratory therapist. Like I just love connecting with other people in healthcare and just learning more about, you know, your side of things, because we're all a team and we all work together to get the patient better. And we all important. So it's just so good to learn more.
Neither of us can do one thing without the other, even though certain professions are a little more highlighted than ours.
We are still important and needed.
Absolutely. And I'm glad that we are both here, you know, on social media, like representing our fields, because I think it's important, and I think it makes a difference. And I'm sure there's so many students who are looking up to you and taking your advice. So, well, I can't wait to see where you go, you know, in physical therapy. And yeah, anyone who wants to follow Deja can follow her at The Curly Clinician. That's also her website.com, and then her Instagram as well. All right, well, thank you so much. I hope you have a good day, and I appreciate all that you do, especially for the little babies.
Thanks. Same to you. It was so nice being here. Bye.
Bye.